Okay, so give me a wave if you're public advisors. Woo! Hello, public advisors. Give me a wave if you are on a staff table. Hi, staff. Give us a wave if you're a member organisation. Woo! Yes! I knew I'd get a woo. Brilliant. Are we all right? Have we generally found somewhere to sit? What? No, we were waiting for you. I'm just getting them seated. They're a rabbly bunch. Okay, folks. Is there only one Ruth, do you know if there's only one table for public advisors? Can you squish? Are you all right? You'll enjoy it when we get going. Yeah, well, we like rabbly. Okay. Welcome back from lunch. Welcome back from lunch. I'm liking this energy in the room. That lasagna did what we wanted it to. Woo! Okay, you all right? Got a brew, good. You know, you can spread onto another table. Ruth, should we split them up? Oh, that's made them a bit sad. Members, can you wave at us, member organisations? Yeah, so you've got a choice of tables. Choice of tables. Okay, we're going to get going. We are having our next break. They are a rabbly bunch. Oi. Oi. Right. We're going to have our next break at 2:40, just so that you know. So this next bit, the reason we've put you on these tables is so that you, in these gorgeous groups, can really input into ideas. How can we make things even better? What can we bring forward? So we are going to go to the slide relevant to this, one hopes. Yay! It's about sharing your ideas. Are we giving them any more than that, or is that me giving them more than that? That's me. Right, fine. So we'd love you to share your ideas on ARC2, and it is going to be around these 5 areas. Hang on. Okay, so what we're going to ask you to do is share any ideas that you've got for ARC2 on 5 different areas, the proposed work streams and themes. Here we go, we're on it. We've changed this slightly because we felt like this was going to be a better use of our time. What happens next, Ian? We go to each one. Right, we're going to go to each one. So you're going to have time to discuss each one, and then we're going to come back, hear about your ideas, and the panel are going to be wowed. That's how that's going to work. Is that okay? All right, so this is the first one we would like you to share or start discussing your ideas on, please.
Constructive and positive, please.
Yeah, absolutely. But really, like, not what's not happening. Ideas, bring it in. So, on proposed work streams and themes, please. You've got a few minutes to discuss it, then we'll be hearing from you. So, go, 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 go.
And can I also ask you to think, because we will need that information for the bid, for your organisation and yourself, which particular areas you want to sign up for.
Great.
For the bid, please. So do think about that. And if you don't know yet who it would be in your organisation, and you're from a member organisation or whatever, you take that back and say, there's this really interesting thing that they're doing. Would you be interested in doing that, please? Because then we can, when we get the letters from the member organisations, they will need to say which elements of the bid they're signing up for.
A great question. You're having a discussion. You can pop things in the Slido as you go. Up to you. What we're asking you to discuss is what's up on the screen. Sorry. Oh, in relation to those, yeah. Thank you. Any of these questions, we are asking it in relation to the diagram that you've had in front of you.
So can I do some clarification over this?
Can we have Mark's mic on?
Some clarification over this diagram. The research themes, some of which may be called cross-cutting research themes, are the blue verticals. The orange horizontals are how we identify and resource the workforce that we employ with ARC money across supporting the research programs from those themes that will come from work with the ICP and work from the themes coming together to prioritise and establish what work we're going to be doing. So those headings are from the bid to identify inclusion lead, knowledge mobilisation lead, implementation lead, because these are key elements of the way that ARC works that we will be putting our staff against. But those orange ones,
So
they're not themes, they're work streams that will support the work of the themes. So ignore them in that sense.
So ignore the cross-cutting teams, focus on the themes which are in the columns, and then think if you want to change the titles of the themes or make a list of things that you should think should be cross-cutting themes. Does that make sense? So the things that you were saying earlier, things like,
Cross-cutting focus.
yes, mental health, women's health, men's health, things like that, that you would want to incorporate perhaps across.
Digital and analog and digital divide, changing society, all of those things.
Yeah.
Folks, I'm going to check. Anybody in the room willing to share from their table any ideas or changes around work streams and themes? We've literally got 3.5 minutes on this bit now. Yeah, roving mic, Ruth, where is it that we need it? Oh.
On the screen here, we've got maternal health and mental health. We talked about those. Those are focuses that we're going to have throughout the research themes, however they're described. Prevention, I'm assuming that will become a cross-cutting element of this, and we'll always think about prevention. And wider determinants, that will definitely be throughout the public health.
Sorry, folks, I know there's a huge amount to talk about. I know you need a bit longer. I am aware of that. Mark's just going through some of the things that people are putting on the Slido, which would be great.
I'm used to being ignored. And the workforce theme, yes, is a really valuable addition. It is, but it's about, the workforce is about systems change and systems reorganisation and integration, but also about how that sits with the workforce and how you attract and retain and support the delivery workforce. But the other element of workforce we've been asked to look at is how health and social care can enable those people who are not out of work at the moment for various reasons to get back into work and to become part of the workforce. That's another ask of ARCs to the very long list of things that we're asked to prioritise.
Thanks, Mark. If there's anything else you want to add on to this, you've got a couple more minutes of conversation.
Yeah, and there's another comment on here about, which is,
It's tricky.
it's tricky, but we've only got another minute. So, but the point is that this is, if we don't share what's on the feedback from the 70 people outside, then you won't know what others are saying who aren't in the tables. That's why I'm reading some of these out. So there's a comment about smarter objectives. The bid will absolutely have smarter objectives in under each of those themes. So we will put that focusing down within the bigger headings. So don't worry about that.
All right, folks, I am aware that there's a lot to talk about. We're just going to move you on to a second topic. Okay, great. Great. Here are the 5 topics that we're going to be looking at today. I'm going to give you now a chunk of time to actually have this conversation. So I'm going to give you, how long do you want? Does 20 minutes feel like a good conversation for these 5 topics? Or pick something that you're really into? You pick the ones you really want to dig into on the tables, and then it gives us time to hear that feedback. Is that okay? Yeah? I don't want you to be furious at me. I love the love. Okay, I'm going to give you 20 minutes. I'm not going to do that. I'm going to let you make that choice. Talk to one person next to you, and then you can cover a lot of topics. Otherwise, there'll be somebody who misses out on something else, right? All right, folks, I'm going to start bringing us back. Welcome if you come back from a breakout room on Zoom. Zoom folk, you might want to choose somebody from your room to share back with us. That would be really helpful. Oh, nix it. Yeah, they're back, yeah. Okay, great. Welcome back. We've got our roving mics. Okay, I realise this is a huge amount to talk about. I'm going to bring you back now. So how we're going to do this next bit until 2:40 is we are going to go through each of these questions one at a time, have feedback from you, hear from our panel. Is that okay? Yes. Okay, great. So let's go to the first one. I know that we've touched on this, so I apologise, we're sort of going back again. Is there anything that you'd like to add? Anyone in the room? And what we're particularly, yes, great. We'd love to hear from everybody, and we'd love to hear from our early career researchers who are the next generation of ARC2. By the end of ARC2, they'll be the ones hopefully making some other big decisions. So we'd love to hear, no pressure, I'm not looking at you in the eyes. So let's go, yes, and then here, brilliant.
Hello, it's Jane Cloak here. I wondered, and you might have a good reason for having not done this, but whether the themes could actually be named after those national or regional priorities, because then I think it makes the argument easier for you when NHR is looking at your bid, that you are addressing those regional and national priorities.
There's too many of them, though.
But,
Just
but
keep
that's
the mic.
from our, that's
Darren,
our homework. That's
this is
not
the next.
5 to 9.
Yeah, okay, but then those are what Ben put down as a collation of the regional and the national 25 plus themes into those 9, not 5. The guidance themes are, if you've got the guidances on your table, the priority areas for ARCs, it's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. But some of those 11 are about 10 things.
Oh, well, it's just a thought.
I know, no, it's not a bad thought, but it's about, but there is also an element of that there's this risk of siloing. And one of the arguments I made, which you may well disagree with me, but the reason for having broad titles, and people saying, well, that's very broad, is I was going to say in the bid, we anticipate and expect that themes will be collaborating across and between themes on a number of these priority areas. What we don't want is 5 silos only doing the stuff in their own area and not collaborating with others and picking colleagues from other themes and other organisations to work with to look at some of these really big picture challenges. So that you may think that's nonsense and they'll see right through it, and if that's the case, then tell me. But that was part of the reason for having broad themes, is to encourage cross-theme working. And there's a tendency that if you don't do that, the themes go off and do their own thing. And we never actually tackle the big questions effectively. I can see Paula's desperately going to get in.
And then we're going to go to online if there's anybody commenting, Sian.
So I'm just going to follow up on that point. But we only spoke about the work stream themes, and we did touch on the orange, I'm sorry, cross-cutting. Two things in particular, I think we kind of talked about, these are the bullet points, current ICB priorities, and we thought it'd be great to kind of sense check to see is there the flexibility, is the agility in the structure to do something else in 3 years' time when the next...
Absolutely. Well, I'm hoping so with the way we titled them.
Okay,
yes.
well, with that in mind, under multiple long-term conditions, the first bullet point, we weren't quite sure why that was a bullet point, not a cross-cutting theme. It applies, it's absolutely a space for the ARC, not, sorry, do you want me to, it's the support evidence-based commissioning and rapid evaluation.
So, I wish we hadn't done this. And has Ben hidden? Because I didn't do this. What Ben was trying to do when he pulled this diagram together was show, I think, and Ben can speak for himself, but my understanding is, let's try and get what we know that the bullet points are from the various priorities and illustratively put them under the themes rather than this will definitely happen in there. Because I've already moved about 4 or 5 of them myself in my own head. Ben, do you want to respond to that?
Yeah, you can move them around however you like. I mean, that is something that we're already doing, and we have teams doing that rapid evaluation with the integrated care systems, and most of that is focused on kind of multi-morbidity.
So the whole thing about rapid evaluations and evidence-based commissioning, all of that is knowledge mobilisation and implementation. It's all part of that cross-cutting work stream, and there'll be lots of different ways to do it. It was an example of what multiple long-term conditions to improve them, the management of them and the care for them would need to do is to get that evidence-based practice into implementation.
Yeah.
Sorry, to build evidence-based practice capacity and commissioning as part of what we do as normal day job.
Yeah, I mean, particularly when you're talking about complex, care for complex conditions that cut across organisational boundaries, that approach of testing and learning and developing different models of kind of integrated care is something that has come out from our engagement with member organisations.
Yeah, because Ben and colleagues have been around all of the DPHs as well, so there has been, these haven't come from thin air.
Is there anyone else in the room who'd like to... Oh, yes, online, great.
Yeah, Hilary said overall I like the themes as I think that they're flexible enough to be responsive to changing priorities over time.
Thanks, Heather.
I hope so, she's on the committee.
Sharon?
Yeah, I just wanted to give some feedback from the member organisations in the breakout room, which was about the positioning of members in these work streams and what exactly, the question was, what will be the offer? So if you have much bigger organisations, how will they be co-collaborated on some of the elements? And what will be the offer to them? They were keen to know because there are 60 organisations currently, and they just wanted to know, moving forward for ARC2, the positioning of members.
So as I read this guidance, and I remember the person from the department, from NHR, the sort of the big cheese, said, I won't be meeting you before this is launched. Can I say 2 things to you? Read the guidance and answer the questions. So in the Clark and ARC up to now, we had to show that we had raised a co-funding of 25% from NHS and care organisations, at least 25% of the NHR investment. We don't need to do that anymore. What we now need to do is to have letters of commitment from our member organisations identifying which bits of our proposal they are particularly interested in engaging in, and probably a bit about how. So we will have somebody from this group who'll be working with this theme and this particular area of mutual interest, or that I think they will want to see some clear commitments to the proposal to show this isn't just me and a few mates who've written this. This is a collective contribution and collaboration across the North West Coast to meet these challenges, and how and who. That's, I think, what's expected. So I will be coming to member organisations who are signing up to this with draft letters and asking them to fill out those bits. You've seen this is now a much more advanced bid proposal. Can you please tell in your letter where your priorities lie of how your organisation is going to commit to these different elements of the proposal? At least at the start, it may change over time.
Okay, I'm going to pause this one here. We're going to move on to the second area that you were looking at. You can keep inputting on Slido. Ideas for patient and public involvement and engagement plans. I know that you'd put something on the Slido already, so that's great, and that's captured for you. Please share on the Slido, but anybody in the room or online would like to share some of the conversation from your table? Oh, yep, okay. Great. Oh, you've been nominated. Brilliant. We'll go here and then here. Oh, there and there. Okay.
Yeah, so what we have said is that we've got a PA strategy, and what we want to know is that fit for purpose for the ARC2? We want to see transparency of public advisors across themes in the ARC in order to define their roles for ARC2. And you can use the co-leads productivity as an example. The other thing was, although we've got a lot of PAs on register, we gain quite a lot. There's little engagement or active PAs or opportunities, and we need to, in ARC2, avoid tick boxing. And also, we had an idea of non-research roles for PAs, as in educating and raising awareness in the classroom. For example, PAs in the community.
Yes, over to you.
Right, okay.
You're up.
Hi. Yep, I mean, we echo everything that was said on that table, but also we talked about the relationship with the knowledge mobilisation and the need to increase research literacy across all sectors of society, particularly with the links to including people greater access to information, but having less critical thinking around information and looking at the role. We also looked at changing the mindset in terms of the relationship between academics and public advisors and other parts within the system. It's like a whole systems approach, so that it's not an additional to or something. And that we actually saw this as being a real strength in what we have at the moment, and about the importance of building on those strengths. I think it was the importance of those the different voices that contribute to making applied research literally that. It's something that comes out and is applicable to communities and society. We talked about the good work of the public advisors. We talked about the work of the Coran and the importance of having that as part of this mix.
Can I get your top next two, and then we can put the rest on Slido, because you've written a lot.
Yes. We talked very fast.
I know, you were brilliant. But we just want to make sure we capture it.
It's really about building capacity and co-production and co-researchers, strengthening the diversity of voices in the research arena. Yeah, we said some other things, but let's leave it at that.
Darren, would you make sure you capture their writing?
Of course.
Great, brilliant. Yeah, I'm going online and I'm coming to you. Yep, Sian.
Yeah, I'd like to invite Sarah Rogers to speak, please.
Thanks, Sean. So we had an interesting discussion, and it's really echoed what's been said in the room. I like the term the co-peer researchers as well, and the public advisors. But what we said was that we definitely need some cross-arc training for PPIE to support involvement with some of the more technical aspects.
Great, thank you. Yes.
Just very briefly, just to add, we discussed to invite additional new public advisors to really refresh and add to the pool of lived experiences. But also something we will start next year, but I think we could do that across the ARC2 is research cafes. So go out into the community to reach the more difficult to reach groups and tell them this is research, it's not medication you have to take, you can take part in an interview and a survey, etc. So for us to do more outreach work, that's it.
Thank you. Will you, I see you've written definitely more than that. Will you pop it on the Slido so that we can capture it? Thank you. Anyone else in the room would like to hear from you? You up, or are you just smoothing it out? Okay. Yes, here. Are you going to be brave? Yeah, do it. Ruth's coming. Ruth, you've slowed down a smidge.
He's asleep.
2:15.
Right, I'm speaking on behalf of Katie next.
Of course you are, yes.
So just from her internship work, she's been able to engage with more women who haven't taken up cervical screening, aged 25 to 29, in a 2-month period than academic organisations might be able to do. So I guess it's recognising the value of member organisations in it being able to reach parts that others can't. And then in Blackburn with Darwin, we've got a research group with UCAN on board, ELHT research team, ourselves, the voluntary sector, and we're coming up with an approach to involving community researchers into co-produced pathways. And I guess there's a few of us who are ARC members, but we've not done it because we're ARC members, so I guess it's rethinking that relationship with ARC.
So just to thank you, that's very helpful and nicely articulated. So, and it made me think more clearly about what I'd forgotten in response to the public involvement. We often forget, and because I've only said it I think twice so far today, we are the ARC. And I don't mean us three. We are the ARC. So public involvement, yes, there's a core team of public advisors and they're sat at the tables, but not everybody who sat at these tables is a core public advisor team forum member or active member. They come from other parts of the ARC or other organisations in the ARC. So yes, you've got public involvement in the HIN, and we absolutely expect and hope that each of our members with time will have their own public involvement groups and teams, and the ARC can work as some glue and some communication for cross-fertilisation and sharing between those organisations of public advisors, whatever they're called within their organisations, and through the Coran. So that it's not 30 or 40 or 50, we're tapping into hundreds of people who've demonstrated an interest in working alongside NHS, social care, universities to build and deliver a research programme relevant to those populations with the most pressing needs. That's what we need to do, and we can't do it just from a core group of public advisors, because that's not sustainable. It has to be about building the engagement of those other groups of public advisors wherever they are, and letting them know about the ARC and how to get involved and who the people in their own organisation are to talk to and vice versa. So that someone doesn't come from Blackburn with Darwin and said, can you find us a public advisor? They know that they can go within their organisation and say, this is what we're doing. We're coming up with this idea. We need someone to the first meeting or some people to the first meeting. Who do we go to? And then we've really cracked it. But unless we've done that, we've never really cracked it. It's always about, can we go to the head teacher's office and find somebody to help us with this class? That's not how it works. I don't think it's not sustainable.
Yeah, quickly, because yeah.
Yeah, sorry, it's just a very small point. So in practice, we're engaging with ARC advisors and EMRIC advisors, which means that you always get mental health considered when we're looking at developing work, looking at the impacts of the research, etc. Does that need to be explicit in here? And I think there was an earlier point as well about actually this is quite an infrastructure and a building infrastructure that could be utilised by other research. Maybe a facility for that, but there's always a danger.
So in our public involvement and inclusion narratives, there will be, I hope, an emphasis on not using the term hub and spoke, but a better way that is not seen as being hierarchical, of describing how this is a family of public advisors from all sorts of different backgrounds and settings, some of whom will be in multiple organisations. So a number of the people in Emmerich are also in ARC. And Emmerich actually came and fished quite heavily in our pond for their public advisors, which is fine, because that's how we support it. We also offer mentorship for if a new group starts. I'm hoping that as part of the inclusion, as I said, we will invest in those 20 plus primary care sites to build their public involvement in places that don't normally have that, except to say, can we fundraise for an ECG machine for the practice? But actually how we build research into their narratives and their way of working and thinking as patients, as population representatives for that locality about health and social care research. I think that's what we're hoping to do, and linked to the stuff that the table over there was saying about going out to those community groups that don't normally get the chance, whether it's through Coron or through other links we've got, VCFSEs, etc., charities, to get their voices heard. And that, I think, I think that's the challenge that you were setting us over on that table, to do that more effectively, but we have to do it collaboratively. It can't be done just from the core. We have to have the members saying, yes, we're up for that too, because we need them to take us forward into the next decade, which is what we're talking about.
Okay, we've got to move on. The next topic, share your ideas, please, on the clear knowledge and mobilisation strategy. So, of course, input onto Slido. Online, we want to hear from you. We miss you. And anybody in the room like to kick us off? I do still feel like I'm running an auction. I need a hammer. Any bids, please? There's cake in a minute. Come on, you can do it. Yes, great. Ruth's on her way. Thanks, Ruth. Hello.
Hiya, thank you. So we discussed how PPIE and knowledge mobilisation is intrinsically linked, and that actually if we don't get this right, it impacts engagement, because people get involved, then nothing changes. So we really need to think about how we address that. So some of the solutions we talked about was a prioritisation method or mechanism, because you can't put all 500 research projects into actual value or into actual impact. So we need to think about how we do that and think about that. The other things was involving stakeholders at all parts of the development of the research and the implementation, so that isn't just an afterthought, and really thinking with ARC and with our members how we can make a clear pathway to realising value from all the research that we do. So those are the key.
So
great, thank you.
Just picking up on the prioritisation, so that's about the wider ARC. Yeah. And Jane's got the scars to show how hard it was to get the wider ARC membership to actually respond to the surveys, monkeys, about these are the ideas that have come out of the themes. The first level is the themes. So we will have, through the integrated care partnerships, we will know what the top-down priorities are, but those themes are about bringing together the top-down priorities and building the engagement of the public who are at those theme meetings and the practitioners at those theme meetings and the academics at those theme meetings who will drive so of those top-down priorities, what are the practical projects that we think we could be doing, or the implementation that we need to be doing, and which of those are we able to deliver on, and those are the ones that we do. And that prioritisation will be partly practical, but also will come from, to some extent, bottom up from the members. And if we have effective public engagement and community engagement and effective themes, they should meet nicely in the middle. And then it makes my job and Ben's job much easier to say, and these are the 7 things we're investing in this year, and it's you that have decided it rather than us.
Just wait till Ruth's there.
I completely agree, and I think that's a really smart way about going about this, is just think about the mechanism in which we do that, because we all know that a survey monkey is one way, but I think we just need to think about how we do promote engagement in a different way, maybe moving forward.
Hence some of the ideas for shared posts. Ben's got his hand up.
I'd like to then offer this out again online. They've gone quiet on us. Can you keep me posted? Great.
So translating knowledge into changes in practice is obviously, well, everyone knows, is very very complicated and often with multiple stakeholders involved, and it's more than showing the evidence and suddenly they change practice. And I think there's a whole skill set of being able to do that and negotiating and understanding the different relationships involved that is not necessarily academic skills, and often it's people that sit in between kind of academia and member organisations. So I think there is potentially a role for investing in some of those roles potentially embedded within our member organisations that are kind of helping with that that skill set.
Fab. So we've got somebody online incoming.
Yeah, Louise.
Great. Hi, Louise.
All right.
I'm happy to speak if you like. Yeah, I just say that I think we need knowledge mobilisation and implementation. We need to be clear what we mean by those, and then they need to be considered at all stages of development, evaluation, scale up of interventions, so across all the different themes. And again, as been discussed before, they're not independent, so these need to have PPIE and other stakeholders involved throughout. And perhaps one thing that could be helpful was if we suggest having particular frameworks or theories we use consistently, or at least a top 10, if you like, so that we can try and have some synthesis, because there is a danger of everyone.
Sort of a comment is the second one.
That makes that more difficult.
Thanks, Louise. Any feedback from you on that?
No, I agree. And I think we do have proper expertise in this area within the ARC. Sorry if that's not clear. One of the comments.
In knowledge mobilisation or in implementation?
Both, I think, I hope. And the way we control implementation, we can't control it on the wider area. We have to work in collaboration with groups like the Health Innovation Network to be able to do that. But certainly I'm hoping that people come through to us for support with implementation, which we can then evaluate and then spread the evaluation of what barriers occurred, what solutions were found, how they were put into practice to make a difference, so that people have, as they do from the Races and Racees workshops, a basic implementation guide based on what the evidence has said and how the practitioners involved and the public involved in those groups have decided, well, how could we make this work in the real world? And this is an implementation support for people to make this happen and to build that into sort of a rolling program. And yes, it can't all be done by ARC. We then hand it on to the HIN or to the quality improvement leads, who are hopefully finding out what the ARC's doing, to pick it up and run with it. And nobody's mentioned that yet, but certainly in the larger trusts and those organisations, we need those quality improvement leads to be coming along to our meetings, to finding out what we're doing, for us to be feeding ideas through to them to say, these are solutions that you may want to think about delivering in your organisation.
And they need to be feeding burning questions to us.
To us, yeah.
I think that's the thing. We need to think how things become burning questions, because it's those things that people will want to take forward.
Don't wait for ARC 2. We've got an ARC at the moment. We've got knowledge mobilisation fellowships that can bring people in financial support to do knowledge work, and we can also support academics who want to go out into the delivery areas or the commissioning areas to help mobilise their understanding and bring their expertise into those organisations. So we have got funding for that now. Please come and use it.
I'm just going to pick up a question in the room.
Not a question, just a feedback from our discussions that we were using this as an opportunity to look at how we can build on our existing capacity building activities to make sure that we have knowledge mobilisation at the beginning of that and implementation at the end of that. So that's what our conversation was around, how we mesh those three together, perhaps better than we have done in the past.
Yeah, capacity building in the bid is a fairly specific thing. To some extent, it's about academic career development, which is slightly disappointing, but I suppose that's what NHR are tasked with doing for health and social care environment and system, to provide the academics of the future. So that's part of what we're doing, but it's also looking externally about building those skills and that expertise and knowledge in our organisations. I talked about learning organisations and
A learning culture.
organisational excellence as the goal, and I think I'm going to be using the same phrases in this bid as well, because that has to be what this is about, that it becomes normal in working in these organisations to think, what can we learn and how can we put it into practice to improve our work and the delivery of what we do and the cost effectiveness and value for money, etc.
Yeah.
Sian, those two questions, can you hold those for the Q&A a bit later? Because I'm just going to move us on to our next point, if that's okay. All right, let's see. Our fifth area then we're looking at now, health equity and how that is embedded in our work. So share ideas as ever on Slido, and then we'd welcome online comments, in the room comments. 10 minutes, you're going to have some cake as a treat. So, who'd like to kick us off? Yes, 10 minutes till cake.
Nobody online with something about health equity?
I know it's imperfect what we do now, but don't underestimate the value of Hayat and then for equity and the number of organisations that have now picked that up and are using it in other ARCs and other parts of the NHR and in other sectors of the infrastructure. We have created something which may have its imperfections but is seen as one of the solutions. So I think we should be justifiably proud of that. Our challenge is to make it embedded in the work that we do rather than, oh, I'll do that later. And we have to, I think, start saying if it's not done and seen to be done, we don't do it. As in, that project stopped. Tony.
It's possibly quiet because it may be none of the tables discussed it. We only discussed it tangentially, I think, but what I'd say is that we've got to somehow manage to make this light and enabling rather than tricky for researchers, but on the other hand, make sure that health equity is mainstreamed. I don't have the solution to that, but I think that the processes we have in place kind of make it a bit daunting and frustrating for researchers who struggle to work out what it is they're going to get from the ARC in return for
so we have to support them better in doing it, but I think it has to be, I know it's hard and tricky because it's not something we've been brought up to do, but I think it's written through this bid that we have to show that we're doing it. And it's not it's not like too light touch, that it actually delivers a product at the end. But that's just my reading of what I think we're asked to show.
Yeah.
Right, so through health inequalities lens, I can't actually eat cake.
I am sorry.
Diabetes.
There's
So
bananas.
I'll make a comment instead. So I think everybody's doing health inequalities, but there's probably things that we could all be doing better. And I wonder whether it would be worth having a point of contact for that to say, what else could we be doing? Can we have help with this? Can we have help with HIA, various other approaches as well?
Great.
We have
Thank
that.
you.
But yes, I get that, but we also probably need to say what it is that we do and what we focus on and what we can provide the support for. So that's why the For Equity website has a range of different models. And I think as team members, we need to have at least one person in the team that says, I'm familiar with that one, I'm familiar with that one. So if somebody comes and says, I don't want to do a HIAT, but I want to do this, we can say, yeah, that's fine. Go to Mary. Mary will work you through that one instead.
Okay, we're going over here.
Hi, yeah, Alan Griffiths again. I mean, I was on the team, the For Equity website team that put it together, and that's when I think it's the second version of the HIAT was written. The original one being extremely complicated and difficult to understand. I actually think the current one is fairly difficult to understand and is hard work for anybody. If it were down to me, I would suggest that we write a third version of it now, which is easier for public advisors to use to help the researchers to do it, and easier for the researchers, because I think at the moment it's like building a wall for them to climb over in order to carry on with their research. Also, of course, we need to make absolutely sure that once the research is started, they still continue along that equity route, because it would be very easy for them not to.
Yes, hi.
Yeah, it's just building on what Alan was saying, and I think I've noted it in the slide though. Unfortunately, I think our metrics at the moment are really are too prescriptive for some of the reasons that Alan and others have described. You know, we've got GRIP 2, we've got the second iteration of the HIAT, so I think maybe something about simplifying it. We know lots of our projects, as Andy said, are already inclusive of the equity lens. We're just not great at demonstrating it, which I know is a bit of a balance. But Mark, you've talked about the We Are ARC, absolutely get it. So in our work, is not just us. So yes, absolutely, we know we have issues and challenges with the prescriptive nature of the tools that we use currently, but we've got health equity research champions in about 7 or 8 organisations. That's impact, that's our work. Our work's going out to member organisations, doing the do. You know, we've got a health equity mainstreaming strategy for people who aren't aware. All the things that we've been talking about now are all in that strategy. We just need a more, I don't know, maybe a more simplified action plan to take into ARC2. We're doing shed loads of work. We're doing masses and masses and masses of stuff. I think sometimes we over-prescribe, so we need to think about different levels or different sort of touch points on a continuum of delivering health equity that members and others and public can all say, well, I've contributed to our equity conversations because I do X. So it's not just filling a form in.
Great.
Absolutely.
Thank you.
Someone talks about heat. I think heat is a different focus from HIAT. It doesn't cross-translate readily, I don't think, to research. That's why we developed the HIAT.
Yep.
Selena, the Public Involvement Manager. I would argue that GRIP 2 isn't onerous, and that it's just making sure that we are celebrating the impact that we have of the really effective co-production that we do, and making sure that we demonstrate it, that it's been done in things like the Puma that we've just advertised in terms of the amount of public advisor co-authors that we have, and building on that work. I think the HIAT is about collaboration and a conversation between all the stakeholders around the table, saying how are we going to make sure that equity is embedded within this research study. And that's going to be even more important when we're thinking about inclusion of groups within as participants in the research study and the HIAT process, and the GRIP 2 should all be built in together, and hopefully that could be made easier by a database that is easy to access for everyone and can show in real time how studies are evolving and how people can get involved with them. And I think that would be a central team thing that could work really well.
So, yeah, the HIAT is and the 4 equity is a toolkit. It's not a you have to fill in every section and in a particular way. It's a guide, and I think hopefully it's an adaptable and flexible guide, and it is a living document. And I don't know whether everybody realises, if you look that Selena just said about Puma, we should be immensely proud of the proportion of the work that comes out of ARC into academic literature that has public advisor and practitioner co-authors. It's a pretty much universal of the publications that we write as an ARC. There'll be other publications on that database that people who work in ARC have also written that relates to applied health and care, and that's the rule to collate the wider work. But our core work is incredibly inclusive, and we forget that, I think, when we self-criticise too much. I don't know of many organisations that can proudly, I've been abroad and tell people this, and their jaws drop, that we actually deliver what we say we mean, that we genuinely have co-authors who've inputted to, commented on, participated in our programmes from beginning to end, and that, I think we should be justifiably proud of that, and it will come out, I hope, very strongly in the bid document. But we do, I think, over-criticise ourselves sometimes and don't realise just how it's not perfect, but we do a lot more than most.
Okay, I realise I've lied to you. I'm sorry, we do have one more, value for money. So let's go. Please input your ideas on Slido. We'd love to hear from you in the room, as ever online. How ideas to demonstrate value for money. This keeps coming up. This is your moment. Hi, Darren.
Hello, nice to see you again.
You too.
just feedback from the member breakout
Great.
room again. In terms of value for money, prevention was mentioned, and how much would that be in the ARC2 bid? Because there was a lot of member organisations who could help with that agenda, and they felt they could have a role to play in that. And there was a definite case that, you know, closer in alignment with members and what ARC was doing in its plans would deliver value for money, both for the NIHR and the members as well.
So someone's put here value to who, so I'm going to be really pragmatic here as an art director. We are, and Darren will tell you this too, we're constantly being badgered by NIHR, who are being badgered by Treasury. Show us the money. What have you delivered for the investment we've made? And they want tangible impacts, which is hard to do around health inequalities, but show us how that investment has made a difference. And they don't mind the Mrs. Trellis story. Mrs. Trellis of North Wales, as a result of our work, is now doing X and Y. For anyone who ever listened to, I'm sorry, I haven't a clue. But it's those good news stories that the ARCs are expected to deliver for NIHR through to the Treasury. So I know that's not what people like, but that's the realpolitik of what we need to do. How have we made a difference, and how can we show we've made a difference? What's changed as a result of our work? And if we can produce 1 or 2 or 3 of those a year, they'd be very happy.
Going over here, hello.
Hi, yeah, I'm Sandra, I'm a public advisor. I'm talking about value for money. One of the comments we came up was using co-leads productively. And could we measure how we as co-leads are giving value to money? But also not just the co-leads, but the public advisors about demonstrating how we are value for money as well.
Great, thank you. Anyone else in the room or online? Online, Sean, great.
Sarah Rogers has said in terms of demonstrating value, where is the explicit mention of health economics to comply with the guidance notes?
You mean on the current diagram? Don't believe me, it is part of those work streams. There's plenty of health economics. It's in the work stream theme. There'll be a lot of health economics. It will be written in because it's an expectation. And we would have failed to answer the exam questions if health economics wasn't very clearly outlined in the bid.
Anyone else? Are there any of those that you want to pick out, panel?
Oh, come on. Everybody wearing the same kit and playing with one ball? If only. I mean, let's be realistic. If they're on the same pitch, I'm quite happy, to be fair.
I'm enjoying that metaphor.
And at the same time, that would be good. I'm joking apart, but no, I mean, we have to be we have to be inclusive, and not everybody likes to wear red and white. And I don't mean Liverpool's.
And I think there's been a few that have come up, and I mean, I've mentioned this before about the collaboration, collective resources, doing things together.
Yeah.
You know, like I said, we are all ARC, but if we work with all the other bits of North West Coast, that's a lot of people and a lot of resources to maximise.
I think my answer to that would be wear what you like, but let's try and play the same game.
Okay, on that note, one last one,
yes,
and
please.
then we're going to have a break, folks.
I think it's been mentioned in the comments, Mark. So one of the barriers to realizing value with implementation is lack of incentives following that implementation, and be it pathway transformation or be it implementation of products, and that has to be dictated from higher up. So one example is if you want to replace something else for an endoscopy, the tariff for endoscopy should be disincentivized to accordingly incentivize the appropriate intervention, if that makes sense.
Yeah, so with some of which we have no control over, but we can talk to the organisations to say, as part of this implementation project, what are you going to ask people to stop doing so they can do this instead? And one of the things that as a GP, I would say this, wouldn't I? GPs have been having so much extra work loaded on primary care, but nothing's been taken away. And so, and I could, if anybody wants to tell me you can't get to see a GP, I've got some stats for you. So half the population of Liverpool was seen, had an appointment with a GP in October. half the 300,000 appointments out of 600,000 population. But anyway, so people are really busy. So you have to incentivize them, and that's why the prioritization from the bottom up is so important, because the top down can keep saying we need to do this, we need to do that, but unless we engage with our members and the staff and the populations that this is important, then there'll be lonely meetings with nobody coming along and things not happening. So we really need to engage with people, and that relies on the champions in our member organizations to outreach or into their organisation, I think, as well, to do that work for us. I don't know whether you have a comment on that, or no, to take the mic off you, but it really does rely on those organisations feeling empowered and interested and engaged with what we're doing.
I certainly think the enthusiasm hasn't died out completely, but I hear what you say in terms of clinicians' engagement and operational managers' engagement has kind of diminished quite significantly, especially for new intervention implementation. So that's why I think the incentivization program should be kind of designed accordingly. If you were to take off something and implement something new, then it is quite difficult without any money following that pathway transformation.
No, I agree, but that's not something we directly put. That's the wider ARC membership. The leaders from those member organisations can do. We can't do it as the ARC itself. A bit worried about these top 2 points. Have we nailed down that North West Coast is the right footprint, and are there competing bids? Not that I'm aware of. And yes, it is the footprint because it's the one laid down in the guidance. So they are expecting those 15 geographies to be those geographies that people bid for, and they're not expecting them to be divvied up into smaller components, is my understanding of the guidance. But they're not promising that they will deliver an ARC in every geography in the first round. And if they think that an ARC isn't fit for purpose, they won't fund it. And my understanding is they will go to other ARCs to take it over. So each part of the country will have an ARC, but it might not have an ARC from its own area. It may be that somebody else is asked to help support it and give them more money, is my understanding. Have we nailed down that we're the right team? Well, I hope so, because it's got to be in 7 weeks.
Right, folks, thank you so much for your input so far. We're going to have a break. Can we have you back, same tables, at 3 o'clock? Thank you very much. Tea over there, fruit, cake.